Good morning, good afternoon, everyone. Thank you very much for joining this call, and we welcome you. And as we wait for everyone else to join, I would just like us to start the session with a few tips for engaging today. And just to let you know that as we continue, there will be live interpretation during this session. So please select your preferred language, whether it's English, French, or Spanish, by clicking on the interpretation button that should be somewhere down on your screen, so that you're able to select that. So we also have a very large group that has already joined, and more will be joining as we continue. So to be able to just save on time, we will have no formal introduction, but I do encourage you to register yourself in the chat. You can just put your name, the name of your organization, and probably your country, so that we also just get to know you. Olan, if you can also show us the screen, or if you can put the agenda on the screen. So for the next 2 hours, this is how we intend to spend the time. We will be having a panel discussion and then head into some group discussions at some point and report back to the meeting. So we will then have, immediately after the panel discussions, we will have a session for any Q&A before we get into our various groups. And during the panel discussions, we encourage all of us to be attentive so that the discussions that follow on will be quite informative. Thank you. So once again, I would just like to welcome you to this very important meeting of the Civil Society and a Community Dialogue on Pandemic Preparedness and Response. My name is Patricia Jokonaya. I work with LVCT Health in Kenya as a Senior Technical Advisor for Policy and Partnership and a long-term partner of the Frontline AIDS. We are delighted to co-facilitate this important dialogue alongside our other partners at Frontline AIDS, at STOPAIDS, AidsFonds, AVAC, GFAN, and GNP+. Many of us have seen that as the world struggles to address COVID-19, there is increasing consensus amongst governments that urgent action is needed to strengthen capacity to address any potential pandemic that may occur in the future. Various government-led high-level initiatives and proposals have been made looking at ways to achieve this. But so far, outreach and engagement of civil society and communities in these discussions has been quite weak, if we are to be very honest. So, and this is leading to an increasing gap in intelligence and knowledge about pandemic preparedness and response among civil society and communities at all levels. This should be very concerning for all of us. One of the key things that we have learned from the HIV movement over the past several years is that communities and civil society need to play a key role in any successful pandemic response. If these efforts to prepare responses against future pandemics are to succeed, it's important that we as civil society and communities are at the top of the latest developments and work together to make sure that we are engaged at all stages in the process. We need to fight to make sure that for any future pandemic responses that are developed, we as communities and civil society are involved in their governance, planning, and implementation, and that we build on the learnings and experiences of COVID-19 and HIV/AIDS community systems. So for this civil society and community dialogue, we want to bring all of you together. Firstly, so that the civil society and communities have an overview and an analysis of the latest pandemic preparedness and response developments. And secondly, that we as communities and civil society take the first steps in discussing the way forward in being involved in pandemic preparedness and response agenda at global, regional, and national level. Now, many of us have been involved in these online events before. We know that things often can run over time and get delayed. So we are going to jump straight into the panel discussions now and have as much time as possible to hear the panelists' points and then have a wider discussion with each other during this time. So the full bios of the speakers, I will be reading them out as I introduce them one by one. We have with us our first speaker, who is Eloise Todd. Eloise is the co-founder of the Pandemic Action Network, an international partnership of over 250 diverse organizations working collectively to bring to an end COVID-19 crisis and also to ensure that the world is prepared for the next pandemic. Eloise will provide valuable background and context for civil society and communities on what exactly pandemic preparedness response is and why it has become a key priority topic in the wake of COVID-19. So I will hand over to Eloise, and then I will introduce the next speakers as we go. Kindly put up the presentation for Eloise, and over to you, Eloise.
Thank you, Patricia, and hello, colleagues. It's wonderful to be here. Thank you for the invitation. So we've got about 10 minutes, so I'll try and rattle through these slides quickly and keep us on time. So for the first substantive slide, if you want to move on, what we're trying to answer today, what the team asked me to talk about, what is pandemic preparedness and response, and what are the opportunities and challenges for communities and civil society, and why has it become a key priority topic in the wake of COVID-19? And before we kind of get into it, what I'd say is I think there's different dimensions to this. There's the opportunities and challenges for communities and civil society in terms of the challenge of another theme, another area, and the fact that we all need to be working together on this and find ways that we can reinforce each other and not kind of be sort of going for scarce resources. But there are also challenges that we all face because of diminishing political space. And I'm hoping that through the context of this short presentation, we'll see that we hopefully can be stronger by working together in the ways in which pandemic preparedness and response does overlap with a lot of existing health challenges. And just to, before we move on to the next slide, why it's become a key priority topic. I mean, one of the issues we have is that it is indeed a key priority and has to be, so that we don't get ourselves into this situation again. But we are obviously struggling now for political attention because of the terrible situation in Ukraine and all the oxygen that's taking out of leaders' time and energy. But there's also a reality that even when we were at the peak of COVID, it was actually still quite hard to get attention on the international and global dimensions of the pandemic. So next slide, please. So what is it? Now, one of the challenges is there is no fixed definition, would you believe? But there's lots of background papers. There's the international health regulations that provide the kind of, when a pandemic has kicked in, here's the rules that we should follow. And those are being looked at and slightly rebooted. They are good and they are all very sensible, but if you read them, you know, how to enforce them is a problem. Obviously, the WHO talks about definitions, and quite recently, the IPPPR came out with a report last year on pandemic preparedness and response that gave excellent sort of background papers into this. I also wanted to point out that while we talk about pandemic preparedness and response a lot, there's also pandemic prevention, preparedness and response. And there are groups that talk more about, well, how do we even prevent, you know, are you preventing an outbreak at all, like a pathogen even existing? Or are you talking about being prepared for when that outbreak occurs? So even within like pandemic preparedness, there's a question mark as to what you might mean. And there are people that focus more on the One Health side of things and the links with climate change, for example, saying, well, actually, if we you know, stop deforestation, if we look at the root causes of zoonotic spillover, that's where we should be putting our efforts, so we don't even have the risk of a pathogen occurring. But then there's the other part of preparedness that people sort of recognize more, which is, well, if it happens, how do we make sure surveillance is in place so it's detected quickly, systems are set up and functioning, both in terms of sharing that information, but also health systems being strong enough to respond. But in a sense, the better your pandemic preparedness is, your health systems hopefully aren't put upon as much, because you've actually detected and had good policies at the outbreak. So at the Pandemic Action Network, one of the things that we've been seeing over the last couple of years since we started in April 2020 is that this sort of siloing, even between preparedness and response and prevention and management, is like a continuum or a mutually reinforcing circle, that if you seek to prevent, that's the best way to prepare. If you prepare to respond well, then your response and management of a pandemic will also reinforce good preparedness. So even the sort of policy silos that we have within pandemic preparedness are sort of collapsing into each other, as we see that it's all interconnected, and we need to do preparedness in a way that helps the current and ongoing responses, and responses absolutely have to lay the foundations for the future. And that's where there becomes a big overlap with things like health system strengthening, pushing for proper integration and consultation and communication at not just the national level, but subnational level and community level, as Patricia was mentioning in the introduction. And so I think there's many ways in which all of the ways in which we work, whether it's on AIDS or on pandemics in general, can go hand in hand. Of course, pandemic responses need to be tailored to individual situations. So there's a sense of, you can get ready to a certain extent, but you never really know what the next pathogen will bring, exactly what kind it will be, whether you sort of have stocked up on the right kinds of PPE, etc. And then the last point I wanted to make, which here, is that PPR goes beyond health. Obviously, health is absolutely central. But I think one of the things that we're trying to show, and also with our network, which goes beyond health and development and beyond NGOs, is that to tackle pandemics, if we think about the impact COVID has had on all of us, whether it's on jobs, whether it's on schooling, whether it's on social services, mental health, poverty, it's not just a health issue, it's a whole of society and whole of government issue. And therefore every instrument of government should be taking an interest and investing in pandemic preparedness. Next slide, please. So just to give an idea of, although there are different definitions and different angles to take, this is a very recent analysis by the World Bank and WHO, just taken from, if I send the slides around later, that's a hyperlink from something the Indonesian G20 presidency prepared, talking about the architecture being 5 subsystems: surveillance, research and equitable access, health and social measures, health interventions, and then PPR strategy, coordination and emergency operations. And then according to this paper, there are many different estimations out there. This financing need is seen as around 31 billion annually. Now, of course, there is a debate to be had about what that includes and what it doesn't include. How much of health system strengthening does that include, for example, or how much is about surveillance? So this is just an illustrative example. And then next slide, please. I thought it was interesting to see this, from the dark ages back in 2009, this actually quite helpful WHO paper talking about guidelines for pandemic preparedness and response in the non-health sector, outlining 5 key principles and 9 key areas, which includes health, but also food, water, defense, law and order, finance, telecoms, transport and energy, all the areas that are affected and need to have a plan in the event of pandemic preparedness. So that was just by way of showing how there's been sort of a long-term effort to get pandemics kind of recognised as something that all of society and all of government needs to take notice of. But obviously there is a big overlap in terms of what we need to do to reinforce health systems. Next slide, please. So key challenges to the health sector broadly and to pandemic preparedness and response. This lack of definition means that, you know, people can see different things in it. That can be an opportunity and a threat. Lack of clarity on the epidemiology of COVID right now is difficult. You know, how much should countries be preparing that feel like they want to invest in other health issues, but when infections are rising and we don't know if there's a dangerous variant around the corner. And at the moment, the world is kind of organized, rich countries are organizing as if everybody has been triple vaccinated, which is obviously not the case. COVID fatigue, everybody's, you know, over it to some extent, wants to be over it, even if the epidemiology is not giving us that evidence that we still need to be vigilant. We've had a bit of a failure of political leadership, even in the sort of hot moments of the pandemic where there's been 24/7 attention. It's been really hard to get that trained attention, despite the great return on investment of investing in pandemics. We've got structural weaknesses built in because of the impact of the pandemic and, of course, Ukraine. Pressurized ODA budgets and multiple health replenishments. And as I've said, PPR framed as a health issue only when it's a whole of society approach. But that takes us to the opportunities. Next slide, please. So pandemic proofing, in the same way like 10, 15 years ago, maybe even 20, we talked about climate proofing budgets. We talked about infusing climate into all different aspects of policy making. We need the same approach with pandemics. It's got a lot of similarities. It's trans-border, doesn't make sense to only sort yourself out at home when it's something that can travel. So done well, it can bolster rather than compete with other investments. There are lots of no regrets investments in areas that benefit health systems, strengthen pandemic preparedness and response capabilities. And that is one of the key take-homes I would love us to think about today. Where is it that we can combine forces in these times of scarce resources to talk about those no regrets investments that are good for the HIV AIDS community, good for health systems, good for countries, good for communities, but also build resilience for that pandemic preparedness and response. Again, rather than pandemics being another annoying silo within the many that we have in health and development, it can be an umbrella that sort of cuts across everything, this idea of pandemic proofing. Can we pull together on these multiple health replenishments this year that we see and call for some kind of grand bargaining on health financing instead? And then there's also the cost factor. Pandemic preparedness costs are relatively small compared to other health investments. And then another sort of bonus, if you like, from pandemic preparedness investments are that, for example, the CEPI replenishment, in many countries, that money came from research budgets. So it's a way of turning money from other non-ODA budgets into global public goods investments. So next slide, please. Sorry, I realized time is ticking. So conclusions, if we pandemic proof the world together, we have the opportunity to work sort of to find resources now, but have a more strategic push together to try and get more funding overall and better policies, not just funding, for health system strengthening and for health policies and funding that communities need on the ground. And then also we've got this constantly shifting dynamic environment from COVID itself shifting all the time, but also these silos breaking down as we see more and more how everything is interconnected. I've already spoken about beyond ODA. Can we marshal more resources beyond that together to make the wider points about how important it is to pandemic proof across society? And also another, if we can say, sort of conclusion that I think is obvious from where the world has ended up, the North-South dynamic, it's not desirable, but nor does it work in such an interdependent world. And when we've got something like a pandemic on our hands, They are the next international challenge. Pandemics need to be viewed in the same way that climate sort of transitioned from being something that countries cared about themselves to something that only needs to be worked on, both at the community level, but also internationally. We can't work on our own on that. So those are a few bits of food for thought to kick us off. Thank you so much for the opportunity. Sorry for going slightly over. Thanks, Patricia.
Thank you very much, Alois. And I want to move on to introduce our next speaker, who is Mike Potmo. He is the Executive Director at STOPAIDS in the UK, and will give us an update on what the most important current discussions around PPR are for civil society and communities. Welcome, Mike.
Thank you, Patricia, and thanks, Eloise, for that great overview of PPR. So what I'm going to be doing is just trying to give us an overview of sort of updates in the latest context on the current state of play of PPR proposals, which bodies are proposing what, and what role they envision civil society and communities might play in these proposals. So there's two key areas I'm going to talk about. The first one is really around the pandemic treaty, the ongoing process to establish a WHO convention agreement or other international instrument on pandemic prevention, preparedness and response. That's its full title. And the second area is just looking at sort of current proposals to establish a new pandemic preparedness funding mechanism. So just looking at this first slide now, looking at the WHO pandemic treaty. So in December 2021, the World Health Assembly held a special session, the second ever since its founding in 1948, and adopted a decision entitled The World Together. The decision establishes an intergovernmental negotiating body, an INB, you probably heard those letters being bandied around, to draft and negotiate a WHO convention agreement or other international instrument on pandemic prevention, preparedness and response. And in February 2022, the INB met with a bureau of 2 co-chairs and 4 vice chairs elected. The INB is open to participation from all WHO member states, and the proposed timeline is for a convention agreement or other international instrument to be drafted or negotiated by 2024. Next slide, please. So one of the key questions that we're looking to talk about here today and get all of your inputs is sort of really around what is the civil society and community engagement with this pandemic treaty. So following the INB meeting in February, the WHO published proposed modalities of engagement for relevant stakeholders for the work of the INB on the 10th of March to be discussed and approved at the resumed session of the INB meeting on the 14th and 15th of March. This proposal indicates, firstly, non-state actors, those organizations in official relations with WHO, and that includes NGOs, private sector entities, philanthropic foundations, and academic institutions, will be able to attend open sessions of the meetings of the INB, to speak at those sessions, and will be invited to provide inputs to the INB via an electronic portal, an open hearing, and/or a segment of the session. However, broader engagement is very limited. The proposal does not allow for broader civil society and communities who are not in official relations with WHO to attend the open sessions or to speak at those open sessions. And just as a sort of side note here, understand there's only about sort of 200 organizations who have official relations. And as STOPAIDS has sort of looked into it some last year, and actually it's almost impossible now to sort of to get into official relations with WHO. So it's a highly constrained grouping. So instead, the only possibility for other civil society and communities is to provide inputs into the INB via an electronic portal and an open hearing for other entities and persons. That's what the rest of us are called. This will be decided by the INB and is expected to be open to civil society, indigenous populations and communities, academic institutions, manufacturers, industry associations, and individual experts. Next slide, please. So ahead of the IMB meeting on the 14th and 15th of March, over 90 civil society organisations, community organisations and concerned individuals signed a letter calling for the IMB to review these proposed modalities to ensure that the full and meaningful participation of civil society and communities beyond those in official relations with WHO by providing opportunities to engage directly in the drafting process. The letter called for participation to include, but not limited to, opportunities to speak at IMB sessions, both in person and remotely, regional consultations, civil society briefings, opportunities to submit written statements and recommendations, and timely access to documents, and the provision of interpretation services. Indeed, and as we'll hear later on, many of the things that have already been in place for other UN type processes, for example, the UN high-level meetings on HIV and others. So the IMB met on the 14th and 15th of March and discussed the proposed modalities of engagement. And at this stage, they've not published an update on whether these modalities were approved by the IMB, but I'm just going to post in the chat for everyone. So firstly, a link to the open letter that was sent, so you can have a look at that. But also, we did actually just get a response from Ambassador Nunes of the Brazilian government, who's on the IMB, and said that the message was well received and it's being taken into due consideration. Let's hope so. Okay, next slide, please. So just sort of coming up immediately, upcoming opportunities really for further on the WHO Pandemic Treaty. In addition to the ongoing advocacy and engagement with member states to ensure meaningful engagement, one key opportunity is the first public hearing, which is to be organised by the IMB on the Pandemic Treaty. That's expected to take place during the week of 11th of April. We have no further details yet published, but this should be a key opportunity for broader civil society and communities to share their initial thoughts on the process and our demands for meaningful consultation and engagement, but also obviously on the treatment, on the content of the treaty at this earlier stage. Next slide, please. To move now from the pandemic treaty to look at some of the proposed pandemic preparedness and response sort of financing mechanisms that we're aware of. And of course, there have been multiple popping up, and there may well be more, but let's deal with the ones that we know about. So in addition, so there are a number of additional proposals put forward by a range of different actors, including the G20 high-level independent panel on financing the global commons for pandemic preparedness and response, and that was in 2021, and the independent panel for pandemic preparedness and response, IPPPR, in their report in 2021. There are so many of these different bodies which have all very, very similar names that it can get very confusing. But in September 2021, at the Global COVID-19 Summit, Ending the Pandemic and Building Back Better, that was convened by President Biden, the US called on countries to design and establish a global health security financial intermediary fund, or an FIF, as recommended by the G20 presidency's high-level independent panel and other international experts. It is unclear at this point how this FIF and other proposals will be taken forward, but we do understand that there will be a proposal being, or at least initial ideas being brought forward by the World Bank to the ACT-A Facilitation Council in April. So hopefully we will get some clarity on at least what their perception of what this FAF might look like. And of course, that we will need to engage with them heavily to ensure that there is strong civil society engagement. So across the different proposals made in 2021, the level of civil society and communities really engagement, involvement varies significantly. So firstly, dealing with the Global Health Threats Fund and the Global Health Threats Board proposed by the G20 high-level independent panel on financing the global commons for pandemic preparedness and response in July 2021. It sees the role as relevant as civil society organizations as advisors. This would either be on a permanent or rotating basis alongside One Health partners, major global health intermediaries, regional health centers for disease control and prevention, philanthropies with large role in funding global health and pandemic preparedness, and leading private sector participants. Then a Global Health Threats Council that was proposed by the Independent Panel for Pandemic Preparedness and Response in their report in May 2021. Their proposal consists of 18 members, including 3 civil society representatives. And then the Pandemic Preparedness Partnership launched by the UK government under its G7 presidency was incredible in not including any civil society representatives at all in its partnership. So that's obviously not the way forward that we're looking for. So last slide, please, next one. So going forward, civil society and communities must be meaningfully engaged in the development and governance of any new mechanism. Global health organizations engaged in the HIV response, such as Global Fund and UNITAID, have really demonstrated some of the strong examples of meaningful participation of civil society and communities in their governance, including permanent civil society and community constituencies at the governance level, voting power equal to other constituencies, including governments, and funding to support civil society and community representatives in their governance roles and to facilitate broader civil society and community engagement. And these things are really fundamental. And these principles formed the basis of calls for meaningful engagement in the ACT Accelerator, and any future pandemic preparedness response mechanisms must build on these principles. So in order to ensure this is taken forward, we're looking to develop a set of governance principles outlining what constitutes the full and meaningful participation of civil society and communities. The idea is for these principles to be co-created by civil society and community organizations. And we invite all of you to get involved with us in helping to co-create those. And I'll put an email address to contact if you're interested in the chat. But that's it from me. Thanks very much.
Thank you very much, Mike, for that wonderful presentation. We will now transition as I welcome Cindy Kelemi. Cindy Kelemi is the director of BONELA in Botswana, and she's going to speak to us on the experience on the ground adapting their HIV services to COVID-19 pandemic and the role of HIV civil society organizations and community response will need to play in the next pandemic. Over to you, Cindy.
Thank you so much, Director of Proceedings. Good afternoon, good morning, good evening. As already introduced, I'm Cindy Kelemi and I'm the Executive Director at BONELA. Madam Chair, if you would allow me to switch off the video, I don't know whether it's real or perceived, but I have this strong belief that my internet works better when I'm off video.
No problem, you can go ahead.
Thank you so much. And thank you for the opportunity to speak at this forum. You will all agree with me that COVID-19 has exposed us to quite a number of lessons. And one of the lessons that we learned is about the fragility of our health systems. We experienced, especially for ourselves here in Botswana, that at the height of COVID-19, our health system was overwhelmed. We experienced shortage of even basic things such as your health personnel, your oxygen, to shortage of commodities as well, including condoms and lubes. So it became a really, really desperate situation on the ground. The pandemic also disrupted services, especially services that are provided at community level. we actually have documented cases of loss to follow-up as a result of interrupted community services. We did resort to online-based services, but the challenges were still imminent and the challenges were still real. The pandemic also disproportionately affected key and vulnerable populations, as well as those who are marginalized, especially those with underlying health conditions such as HIV, cancer, non-communicable diseases, and others. And one of the things that came to the fore was that access to shelter, for instance, for key and vulnerable populations became a real challenge. And even continuity of services for the vulnerable and key and marginalized communities was also a real challenge. We also experienced an increase in the incidence of stigma and discrimination, as well as mental health challenges. Also adding to that is gender-based violence, or we also saw an emergence of an epidemic in the form of gender-based violence. Children were molested and in some instances by their own families. Basically, the underlying issue is that COVID-19 has exacerbated existing inequalities. For instance, issues around income, poverty, employment, and of course, infringing on freedoms for most people. It is therefore imperative that communities are well prepared and positioned for pandemic preparedness and response. This is so because there are quite a number of lessons that we are learning from HIV or our response to HIV and AIDS, that if we involve the communities fully and intentionally so, there is quite benefit in ensuring that we have a community-based response that responds to the needs of communities. So our belief is that the goal for positioning and communities for pandemic preparedness should be to build resilient community systems for health. And there are principles that we should really be intentional and serious about ensuring that they are upheld. One of the principles that are critical in terms of ensuring that communities are well positioned is the fact that when we talk about people-centered responses, they have to come from communities, because it is communities who know what the needs on the ground are, and they are also well positioned and equipped to be able to address those needs. We also know that communities play a catalytic role. They are very well positioned to deliver innovation, best practices, ensuring quality of services and service delivery efficiencies. So these are some of the issues that we need to be cognizant of in understanding that the communities do have a role to play in terms of pandemic preparedness and responses. We also have to be intentional about meaningful engagement and participation of communities, both at the level of service providers as well as service recipients. I think from the previous speakers' presentations, it is clear that we need to do quite a lot more in ensuring that communities are at the table as we discuss how they can be positioned for pandemic preparedness and response. I think there are quite a number of lessons that we can draw from the HIV response. We have coordination mechanisms at different levels, from community, subnational, national, regional, as well as global levels. So if we can be able to create such opportunities for engagement for communities, that will be really go a long way in ensuring that we have a strategy that really encompasses communities. We also need to be mindful that a lot of services that are being provided, they have not been meaningfully uptaken because of issues around stigma and discrimination. And communities have over the years, especially in this HIV space, have been addressing stigma and discrimination. So as we move towards pandemic preparedness responses, it's really important to note that addressing stigma and discrimination should be central to the work that we do. We also have to be deliberate in our effort to really meaningfully end inequalities or work towards ending inequalities. We need to ensure that our programs promote social justice and that they endeavor to ensure that there is equity in access to services. And these are some of the interventions that have been done over the years by communities, especially from the HIV response. And we strongly believe that this can be adapted to be used for pandemic preparedness and responses. Another key element that communities bring to the fore, which we mustn't forget as we organize for pandemic preparedness and responses, is social mobilization. We know that it has been documented as an effective strategy for galvanizing and engaging communities for a common cause. You will all agree with me that communities have been instrumental in mobilizing people for whatever issue that needs to be addressed. And that mobilization is what really builds buy-in at a community level and ensures that any resources that are available at community level are able to be channeled towards a collective cause. Another area that communities have been good at and that we believe can provide some valuable experience in terms of pandemic preparedness and responses is around where communities are able to identify community problems and articulate community solutions and define priorities and resources for community engagement. This basically will allow us to have community-led responses, which is really critical in our endeavor to position communities for pandemic preparedness and responses. I think one of the things that we have learned from the HIV response is that it's one thing for us to acknowledge and put in our policies and in our strategies, but it's another to fund community-based interventions. One of the weaknesses of the HIV response has been that in some areas, such funding or such resources become limited, and when they become limited, it weakens the entire response to HIV. So we would want to avoid those lessons or those bad examples, such that in this particular new phase, we are able to position communities with the adequate resources that they need in order for them to meaningfully engage and meaningfully participate. That, of course, will also help in terms of good governance and ensuring accountability at many different levels. We also know that the engagement of communities will help in terms of addressing the negative and social, cultural norms, beliefs, and practices that perpetuate health and human rights violations. In our view, this is critical for any response to any disease whatsoever, that the addressing cultural norms, beliefs, and practices is prioritized, and also the human rights response is prioritized. However, it's also important for us to acknowledge that in order for communities to do this work effectively, it is important that there is some capacity building for communities to be able, for instance, to to be able to, to provide routine data collection, analysis, and reporting. That is very important in that it helps in terms of ensuring that best practices and lessons learned can be built into programs and policies. We also want communities that are capacitated to do action research as well as surveys, so that they can continuously improve the work, but most importantly, be instrumental in terms of ensuring that health outcomes are achieved. We also need capacity for communities to do data quality assurance, which is important because as long as the data that is coming from communities is not acknowledged and appreciated on the basis of quality, then it becomes a problem. We here in Botswana, we implement programs, but especially key population-related programs. But when you go at a national level, that data is not available. So as long as that we have such gaps in terms of monitoring and evaluation, community work would remain at community level and not help in terms of influence policy. We also have to build capacity for communities on advocacy to remove social and legal barriers. This is important, learning from the HIV responses, that as long as we have an environment that does not enable access to services, and an environment that criminalizes certain groups, an environment that has, gender inequality and other harmful norms, then we are unlikely to achieve our health outcomes. Therefore, capacity for advocacy for communities is really important so that they can begin to hold duty bearers accountable for the services that are to be delivered or should be delivered. So in our view, it is important that communities are continuously engaged in the process. I think speakers that came before me did indicate that community engagement is really limited at this point. I, however, want to remind us that with the HIV response, we did not get engaged on a silver platter, or we didn't get opportunities to engage on a silver platter. We had to lobby, we had to advocate. We were on the streets so that we can be recognized, so that we can be acknowledged. And I think it calls for that same level of vigor and interest to participate, to the extent that we will do anything to be part of this, to be part of those spaces. We know that more often decisions have been made without communities, and it is only when communities push for them to be engaged that the space can be created. So I guess what I'm trying to say is that we need to see communities standing up, saying we want to be part of the process. We want to be at the table where decisions are made. But most importantly, we want to bring in lessons from the HIV response and other responses in order for us to meaningfully contribute to this agenda of pandemic preparedness and responses. Thank you for your attention.
Thank you very much for that presentation, Cindy. Last but not least, we will move to hear from Florence Riako Anam. Florence is the Love Alliance Program Manager at GNP+, and is going to talk with us on the potential CSO and community collaboration and engagement on PPR going forward, based on the learnings from the role of CSO in realizing the objectives of the 2021 UN Political Declaration on HIV and AIDS. Welcome, Florence.
A pleasure to join this conversation. At the 2021 UN high-level meeting on HIV and AIDS last year, member states adopted the Political Declaration on HIV and AIDS. Its theme is ending inequalities, and getting on track to end AIDS by 2030. In my intervention today, I will reflect on the experiences of engaging in this process, show possibilities of what's possible with our collective community and civil society efforts across these and similar other global processes, attempt, if you will, to bring in some of the lessons from HIV that all my preceding speakers have talked about. The political declaration we all know is crucial in steering the global AIDS epidemic response for the next 5 years. Its successful implementation demands strong commitment and partnerships at all levels, including a strong civil society and community-led advocacy, as well as sound accountability mechanisms across all stakeholders. But this can only happen if community is engaged right from the start, which is what happened in this process. GNP Plus and AidsFonds were selected conveners together with UNAIDS to coordinate the multi-stakeholder task force, whose job was to advise the UN President of the General Assembly to coordinate the high-level meeting. GNP Plus and AidsFonds also were coordinating alongside with UNAIDS the community and civil society engagement in this process. This was an experience of learning for many of us, considering this was the first time that this high-level proceeding was happening in a completely virtual platform because of COVID-19. The objectives were definitely clear for GNP Plus and other conveners, which was to ensure that civil society was actively engaged and remained informed in all levels of the process. So all this work that we did and its results gave communities a sense of ownership, because we felt that the successful development of the political declaration had us along all of its level and its processes. It was not given to us, we participated in it. The active engagement of networks of people living with HIV, communities, and civil society through the high-level meeting process laid out the foundation for the accountability efforts that are necessary to realize its commitment and to give communities the legitimacy to actually drive these accountability mechanisms. So I will just attempt to share some of the work that we did. Because the process is really high-level UNAIDS. Previously, some community members have participated. It happens in New York, and only very few people are able to get to those levels and those high-level discussions. It was imperative to sort of break it down, let people know, and I think people have alluded to this. What is this process and how does it operate? So we implemented a successful, so one of the things we did was organize a community high-level meeting engagement guide. So, you know, break down the process step by step with dates, encouraging people, having template letters for people to seek opportunities at country level for where to engage with their key government and mission delegations. We also supported the multi-stakeholder task force in running a successful multi-stakeholder hearing on the 23rd of April. This was basically the civil society hearing to the high-level meeting. So this included identifying and coordinating the agenda, identifying the speakers, prepping the speakers. People were operating virtually, supporting people to be able to engage with the process, but also to understand what the key messaging was. So there was a lot of support, technical support given throughout this process. This didn't happen with GNP Plus and AidsFonds alone. There was a lot of coordinating with technical expertise across different thematics. So a lot of collaborative and strategic engagement also had to take place in this whole process to engage with as many communities and civil society leadership as possible. We organized webinars in 6 UN languages. One of the things we learned out of this is how many people were engaged. The webinars happened in real time, but also were saved on social media platforms, and people could replay them as many times as they wanted. For the first time, we noted an increase in any of the GNP Plus-led interventions from MENA region. And this was because people were able to log into specific language-specific discussions at their time, and engage at every point, but also there was follow-up mechanisms to listen to recordings and email and text if you had follow-up questions. We organized through listservs, moments of intelligence gathering and sharing with civil society community and civil society technical expertise. Most of the deliberations with missions happened in closed rooms. Even us, we were not allowed in there. But we had allies, and this is where the strategic collaboration and connecting happened. So we had allies, civil society allies in these rooms, and they would give us intelligence, which countries need to be urged a little bit more, what was happening, where were the issues. One of the things that came out of this intelligence gathering and sharing was understanding that most of the conservative countries did not have precedent language to push back conservatism. And quickly we organized with other organizations and with support from HIV Policy Lab, we were able to develop a compendium of language that was shared with all missions to be able to help in the negotiations or support the negotiations, if you will. So where there was pushback on concepts, on principles, then they would be able to look and identify the discussions that happened previously, and some of these concepts were already agreed upon. So the actual HLM, again, the whole preparation, there was a lot of different mechanisms for different people, organizing, walking into people's meetings to explain the process when, for example, the Africa, the team from Africa was doing their own, civil society was doing their own organizing on how to reach out to the delegation from the region, to walk in and just support and say, this is what's happening, these are the opportunities, and how to engage with key messages and languages. We did develop with support and lead of the multi-stakeholder task force, the civil society political declaration, which had key messages that helped to ensure our asks remained coherent across different regions, across different opportunities of engagement. So that was really also helpful. Post the high-level meeting, a webinar happened to just understand it, understand what has happened, and identify follow-up action. And after that, we did develop a post-high-level meeting advocacy brief that was really practical for communities to understand, okay, so this has happened in June, but the work just begins for us as community and civil society in terms of understanding what the commitments truly are and what we could do within what avenues at country level, particularly to start to see these commitments come into life. So for example, if it's your engagement with the PEPFAR COP process at country level, to take down and really question and understand what do the 60, 30, 80 targets really mean for community engagement, and start to put people at task. The whole high-level meeting process created a high level of awareness in civil society and community organizations regarding the high-level meeting, the political declaration, and the importance to participate. The civil society political declaration had over 800 signatures to it, both organization and individual. This was a huge number, considering that this was passed along just online. Compared to the previous one, this was a really huge number. In particular, the great interest in the webinars that we saw showed that communities and civil society are really keen and motivated to translate any opportunities into action. We had people reaching out and offering to organize regional specific meetings, and they would do that, just asking for support here and there. And that's why we were able to reach as many people. We had people offering to translate. We had people offering to look at different pieces and communicate them in the context of different countries. So the appetite is there. People just need to know what's happening and when they can be able to plug in. But what do communities then need to better engage in processes like these, or like the pandemic preparedness response that we are discussing today? First, I will just belabor the fact that we need to understand the process. What's the process? When? What are the dates? What are the avenues of engagement? Again, also in understanding the process, I wanted to just say how the high-level meeting was largely virtual. There were no interactive platforms, really, even during as the meeting was going on. But for the multi-stakeholder hearing, because we understand our own community and the need for interactiveness as the meeting is going on in real time, GNP Plus organized viewing on Facebook and discussions live on Facebook. We had technical expertise and people offering to have, discussions and listen and understand and share questions, even with panelists. So it was just a whole coordinated effort of this question gets asked, someone moves it to someone, UNAIDS helps get it to someone, and a question is answered in real time. During the break, there was a civil society, organized Zoom call for people to chat. So just to try and give the whole process that is sometimes always just stiff and welcoming, some welcoming and other interactive platforms on the side, as though we were probably there in person. So some of these things we can be able to do if we understand the process and where we can be able to make it relatively involving, or that works in the ways community interact and talk. Sometimes it's also important to know the process so we can critique it. For those of us who are engaged in the high-level meeting, we know what a rush it was, rushing to meet deadlines, getting everybody, running around in a schizophrenic way because we were delayed, we were late, and the principles of the UN process require this has to happen after this date and that kind of stuff. I think these deadlines and timelines and modes of engagement, sometimes even language, these decisions always lock out participation and sometimes frustrate the interest to engage. And if we know the process, then we can be able to critique it. People have talked about funding and resources, really definitely needed. Communities need to be supported financially to do this. And I will also just say in full disclosure, the amount that was given even to us to co-convene this was very little. It was just because we had support to be able to do this in addition to what was available. So if we need to do better, we have to deliberately fund and resource community engagement in these processes. An enabling environment for mobilizing, organizing, and advocacy is definitely needed, and I think people have talked about it. It is important to support policies that will ensure communities can do their work without feeling like you're threatened or intimidated, which most of the time happens, particularly at country level. So meaningful engagement really should not be an afterthought or just words. It has to be deliberate, and this can only happen when we begin to see communities engaged as experts, and not just because they have lived experience. And to also look at that lived experience as data that can be used to drive and change decisions. We know from experience that when civil society is empowered and communities are aware of what exists and is possible, they can step up to provide leadership and influence policy and programmatic change needed to make health services accessible and satisfactory, not only for them and their peers, but for all ultimately. So efforts on pandemic preparedness response need to leverage on this valuable experience and expertise that is already there and already nurtured and strong, and just needs some level of push to align to what we need to be doing right now for pandemic preparedness response. This is so that we are policymakers and decision makers are realistic to the realities of the people for whom most of these policies and programs will affect their lives. But we can only do this if we work on the principles we know have been working before. The JIPA principle, the greater involvement of people living with HIV, was very instrumental in ensuring that policies and programs respond to people living with HIV needs. In the same case, putting people at the center of every decision-making with pandemic preparedness response needs to be deliberate, because then that's the only way the results will be responsive to the needs of the communities. We have to invest in right-based approaches. We have to invest in addressing gender-based violence, in gender equality, and being deliberate about inclusivity. We then have to work towards ending inequalities, towards leaving no one behind. If this is to work, those things must happen. Working with communities to address these issues is really, really important and really must be done. What I will leave you with is that the ownership that came from our collective civil society and community engagement in the UN high-level meeting last year is already fueling action by civil society right now and communities to design accountability mechanisms in order to understand what our baselines look like and begin to monitor progress to hold our governments and partners accountable. This can happen even in our work towards pandemic preparedness response. Thank you very much.
Thank you very much, Florence. And all our panelists, we really appreciate the great speaking points that have come up. So we'll now move on to the Q&A session. And I have taken note that there are some questions already in the chat, so we will start with those ones and then probably allow 1 or 2 people to just raise their hand using the Zoom function. We have now enabled the microphones and the cameras to enable us also get questions from the participants. So I will move straight ahead to ask these questions that are already in the chat to our panelists. This question, I think it was directed to Cindy. What about the internally displaced populations, the IDPs? They have also been very marginalized and underserved. Any thoughts around how to engage them in pandemic preparedness and response? If you could take a minute, Cindy, and share with us what you think.
Thank you so much. Thank you for the question. I don't think it's only internally displaced people. I think we have to, map, marginalized, vulnerable, key populations, whatever you want to call them, so that their voice can form part of the negotiations, their voice can form part of this agenda. So I think it's about each community understanding who is most vulnerable and who is most affected by such pandemics, to the extent that their experiences, their views, and their opinions should form part of any policy programs going forward. So I think we need to be inclusive and comprehensive in our understanding of who is marginalized and who is vulnerable and who needs to be at the table.
Great, very great response. Thank you very much, Cindy. So we just need to do a mapping and get to know who has been left out and how do we bring them on board. This next question, I would like to give it to Florence, who already alluded to this in her presentation. The main issue we face at community level is those versus without. Those with resources develop proposal strategies and implementation guidelines without involving the affected community. And the person says that I hope there would be a change in strategy where communities will be allowed to develop their pandemic preparedness, prevention, and response. Any thoughts in a minute, Florence?
That's a very tough question. We really need not to have those with or without. But ultimately, where funding is unavailable, people cannot engage to the levels that they would like to engage. Having said that, I think there are organizations who already have opportunities with their funding and with their planning, maybe because of knowledge or prior engagement with certain processes, global platforms, etc., and are able to engage in these processes. So I like to say this for our organizations and when we engage with people at community level. In Kenya, in Bondo, where I'm coming from, we can meet 60 people in a room. Okay, now that the restrictions are not as bad with COVID. But if you get to South Africa for a regional meeting or Ethiopia, you're probably 3 or 4 of you. If you get to the UN, it's probably 1 person. So how do we look at this mechanism and tighten the loop around community, national, regional, and global? Because ultimately, the numbers of people who can engage at different spaces keeps going down. We have learned a lot within the opportunities that the virtual space has presented us with and the strengthened space that has been because of COVID. And we need to take advantage of that. It doesn't matter if it is to bring on board, we called them influencers. So we had UN high-level meeting influencers, a bunch of young people whose job for 3 months leading up to the high-level meeting were just tweeting. We would give them content, make them understand, tweet and engage with people online. So that and that really helped to bring a lot of young people interested and wanting to participate in the process. So I don't want to answer that those who have or don't have, but personally, I think if you are sitting here or sitting wherever you are leading on a community engagement process, then deliberate efforts have to be made to ensure that the loop is tightened from grassroots to global.
Thank you very much, Florence. I think that also answers another question that was on how do we tackle the issue of CBOs contributing to the development of proposals, and yet you have the implementing partners being the ones who are implementing. So just how do we leverage on what is available? And there's another question. This one I will ask Eloise to respond to. And probably Cindy, what are the key next steps within the global and particularly national pandemic preparedness, prevention and response agenda to position the community responses for health on an equal footing within the health system? Eloise, do you want to start?
Yeah, thanks, Patricia. And just building off of what Florence said, I think one of the things that's happened throughout the COVID response, the sort of, you know, a positive development, if we can put it like that, because of the terrible way in which basically the response was completely inequitable. There is a recognition that things need to be completely different next time. And there is a recognition that it was much too global, much too top down, and that actually it's all got to be about what countries need. Now that's the country level. That doesn't mean that there's enough recognition yet of what happens at community level. But I would say that even the discussions, for example, around I think what's now called what might called the fifth, the pandemic fund. The idea of that is definitely evolving to be, how do we get money straight from such a fund to countries to fund their own priorities, rather than going via, frankly, Geneva or, you know, other funds, right? That's not to say that other funds don't do a good thing, but that there's increasing recognitions of how do we get money directly to plans and countries that need it. In terms of where is that practically, you know, there is many approaches as there are countries, and I think the important thing to understand and to recognize is that in different countries there'll be different processes. I mean, in a lot of places, there's the COVID recovery plans are an excellent place to maybe engage in pandemic preparedness and at the community level and the national level. In other places, there's much more of a sort of traditional global health security approach where those things are being looked at again. So it does depend from country to country. And I think one of the things that we're keen to do at Pandemic Action Network is to work with partners in as many countries as possible to give advice on, you know, we don't know about every country, obviously, but some principles and some policies that might be suitable, that can be adapted to local contexts, that can be adapted to community contexts, and to support in that way. And just to say that, you know, the way in which we operate is very much, we have an Africa working group, we have a Europe working group, and we try to basically give support to others. So it's not about us, it's not about our aims, but trying to really be a bit of connective tissue between some of this global stuff that goes on, but what's really happening at the community level. And I think the most important thing is we don't want this to be like, oh, we'll kind of bring news from what happens globally. We want it to be the other way around. We want to inform national and international leaders about what's really important. And so the information flow needs to be the other way. So that's a long-winded way of saying we'd love to work with you, and I'll pop my email in the chat so that we can really serve the people's needs properly and not have these kind of, there's been some great policy debates gone on, but frankly, they get far too abstract too quickly and too disconnected from what's really needed. So again, if we pull together, that would be great. And I think to Chris's point in the chat, the link that he put in, and to Mike's point, I think we have so many lessons to learn from the HIV/AIDS community, and also not only in a practical sense, but also in this phase we're going into with COVID now, which is, it's not 24/7 news anymore, but there's still needs. And in a way, that's where HIV/AIDS has been for quite a long time, after that sort of peak in the 80s and 90s, and depending on where you lived in the world. But for me and where I lived and grew up, it was then. And then how you manage that and how you keep fighting that when it's not front and center, that's the phase that we're going into now. So I think we have much to learn from each other and much to unite and fight for. So I'll put some details in the chat. Thanks.
Great, thank you very much. I think somebody else also put a comment that it's important for civil society organizations to involve different people, different members who are sent as delegations to meetings, so that exposure is therefore something that's given for a number of people. I think I would like to get some reflections from you, Mike. Somebody put this on the chat. A question I have heard about the pandemic preparedness discussion is whether HIV is still being considered as a pandemic. And after all, it's an epidemic in multiple countries. So if so, then all the principles we've developed for upholding human rights, like the GPA in HIV programming and financing, should apply to pandemic preparedness and governance. So Mike, any thoughts around that? The principles within the HIV response, how would we use them?
Yeah. Thanks, Patricia. Yeah, so I responded a bit in the chat to that, and I think as Elise just sort of highlighted as well, there are sort of a wealth of principles drawn, sort of key lessons learned from the HIV response that actually, for those of us in the sector, I think a lot of different organisations and individuals sort of produce some really helpful sort of lessons learned in relation to UHC, for example, in the UHC high-level meeting a few years ago. And then, those are being updated. Those are being updated, and the great example that Chris Collins sort of put in the chat in relation to PPR. So I think there are some really important sort of sets of principles that we need to just draw together again, and just put them forward. We don't need to reinvent the wheel necessarily, although it is helpful to sort of pin, all of these lessons directly to each of the particular components that Eloise really helpfully sort of laid out in terms of PPR. But I feel like, and just sort of responding to the previous question, I feel like one of the most urgent sort of needs, and this is partly the prompting for this webinar right now, is we have just an urgent need for civil society and communities to come together and to demand really, really loudly that we have to be at the table, and we can't allow WHO and other sort of global actors and member states to get away with rolling back the progress that we've made in terms of meaningful involvement in governance and accountability for any new process. Because unless we are at the table, our voices just won't be heard much, if at all. And it will just reinforce the same power relations that we've been laboring to dismantle over the last 10 to 20 years. And that, we really have to build, as I said, on, some of the good examples that we've had. And more recently, we've fought really hard in terms of the ACT Accelerator to get civil society and community representatives into that. And it was a hard battle, but we managed to get them in. Then the next step, and we're then able to have the discussions with the co-lead agencies to say, okay, now you need to have meaningful engagement. And then that really allows us to actually then get the content, these principles, these sort of learnings sort of at the table, rather than sort of trying to just send letters from outside, which, only ever have so much impact. So the number one priority I just want to highlight is that we throw everything right now at the pandemic treaty process to demand our involvement. and for the new FIF or whatever it is, we have to say from the very beginning that we have to be at the table, because if we're not, then we really set back. So thanks.
Great. Thank you so much, Mike, for those reflections. I'm afraid we have really gone beyond the time that we had said before, and so I would request that we close the Q&A. But thank you so much to all our panelists, to all the wonderful questions that came. I will now pass this on to my colleague Fionnuala, who is the head of advocacy at Frontline AIDS, to lead us through the next session of the dialogue. Over to you, Fionnuala.
Thank you so much, Patricia, and thank you again to the excellent panelists and for all the questions as well. So we're going to move quickly into group work, just to flag to everybody that the groups will be recorded and we will be doing our best to capture all of the key points. So although we're going to be a little bit short on report back time, we will make sure that we follow up on those and capture everything that comes out of them. So you're going to go into groups for something like 20 minutes. There will be a facilitator in each group, and please do appoint somebody to be responsible for the report back. You are going to be answering, looking at 3 questions, and these will be displayed by your group facilitators as well. But the first question is, what are the key next steps and opportunities for civil societies and communities to engage on PPR? And the panelists talked a little bit about some of those in the discussions already. The next question is, what are going to be the most effective ways for civil society and communities to work together moving forward on this agenda? Thirdly, what are some of the barriers for your participation in PPR advocacy? So you will be getting divided up into your groups now. Please do click to join your room, and then we'll be bringing you back in about 20 minutes or so. And thanks to all the group facilitators and to my group. Please allow about 2 minutes each just to give us your quick report back. So I'm going to start with the report back from group 1, where I was the facilitator. So on the key next steps and opportunities, we flagged some specific HIV moments with the International AIDS Conference coming up in Montreal. And just to highlight that, I think lots of the organisations who are co-hosts today have already put in for events and satellites and workshops. That's an opportunity for us to share more with our community, but also to reach some of the government, multilateral agencies and donors who will be there. We noted the pandemic treaty, the fact that the ACT accelerators plan to close in September, and the discussions around its future are going to be important for shaping the future of PPR. We also had some really good conversations about the stuff that civil society are doing in the real world of PPR and pandemic prevention as well, here and now, from their kind of continued role around work on hygiene or STI prevention, also around digital health services and the fact that we need to be shaping how these develop now, because they were really important during COVID, but they will be even more important in the event of another global health threat. So how do we really make sure that they're fit for purpose at this time? And some stuff around a health workforce as well, and the fact that communities could really be advocating now for governments to really invest in the health workforce, recognizing the impacts that successive pandemics from HIV to Ebola and then COVID have had, and also on the importance of resourcing community-led responses and community health workers as part of that. And then finally, some stuff around community engagement on, so we've got stuff here on slide 1 and slide 2, but promoting scientific literacy and a knowledge base among community health workers, because they play such a key role in building trust. And then slipping down to slide 2, we had some really good comments in that discussion around the role that community health workers can play in mobilising the different leaders that you see at community level, from traditional, political, religious, business, and also traditional healers. We had stuff on the fact that we need to branch out beyond our existing sector, which is quite health focused, and reach and make connections with other sectors who are also key to the pandemic piece. and some stuff around shaping the governance principles that well. And finally, on the barriers, funding is so key, and it really needs to be, we really need to be talking about meaningful funding that funds salaries that can lead to proper engagement, not stipends to come to a particular event, but without that deeper capacity. Lots of the barriers that we see around all global processes, the lack of recognition of community and civil society expertise, the fact that we often see lip service, but then quite tokenistic processes. And with this process, the fact that it's super opaque, the institutions are new, there's no information going out on certainly on the listservs that many of us are on. And then the funding point again has come up there. And the fact that we need to be making sure that advocacy funding for work in this area is going to communities and going at the national level, not on local level, not concentrated at the international level. I think I've used my 2 minutes and more, so I've set a bad example, but I'll finish up there.
Great. And oh, sorry, go ahead.
Group 2, please.
So we combined group 2 together. So Florence, can you present next from room 3, please?
Can you hear me okay?
Yeah, we can hear you.
All right. So for us, the number one, question one, what are the key next steps and opportunities for, sorry. Yeah, that was the first question. Yeah. For civil society and communities to engage on PPR. So one of the things that came out in the discussion is we need to figure out demand. So we didn't find the spots and spaces. We just thought of the different things we need to think in terms of next steps. So one is figuring out, we need to figure out the demand beyond representation, because I know Mike said, let's focus on getting the space and the seat at the table, but once we are there, then what? So aspects around literacy so that everybody is knowledgeable, and then we would be able to engage effectively should we get the, not should we get, once we do get the seat at the table, what is the agenda setting mechanisms that are existing? So what, once we are there, what are we asking for, or what do we want to do? So this was sort of also discussed around some of the successful high-level meetings, 2006, 2021, was around the organization of representation. So how organized is representation? So there's the work that goes on the back end and the resources around organizing the messaging, building the capacity of the people to effectively represent. So how do we so work around that? The reality that there is inadequate surveillance, particularly at community grassroots level or national level, that leaves a lot of data or information or experiences that is of all the work that community is already doing, but that just remains there and doesn't get to be elevated to these platforms of decision making to be used to make decisions. So how do we also legitimize community engagement at national level? Because this is really lacking. How do we have civil society included in the processes, and how can they be listened to better? And this was also critically discussed. The agenda setting needs to urgently move to national level. It's currently still getting defined a lot at the global level. The risk with that is, first of all, of course, awareness is limited, but there is the risk of having these definitions being too global for national level action. And so civil society at national level are not able to engage with it or engage their governments and government delegation, let's say to the WHO meetings, etc., to engage with this, these definitions in a way that could create change. So we need to start to engage civil society at national level with the understanding of the agenda, or to together set the agenda and make definitions. The second question, what are the most effective ways civil society can engage together, collectively prioritize and work together, the strength in voices, so that we are all speaking the same language and reducing inequality between us. We thought it would be best to circulate the letter for other civil society endorsement now that we've heard about it in this meeting, some people for the first time. And then also begin now to identify, social engineering was the word, what we would like to see as communities and sort of like drive that or present that. What is our visioning for the treaty, for the intermediary fund mechanisms and all the other pillars, so that sort of like a similarity to the development of the community political declaration. We have something laid out that we share then with policymakers in our lobbying and advocacy. Finally, some of the barriers, many civil society not aware of the process and so don't know how to engage. There is no clear definition of what impacted communities mean for pandemic preparedness, and what does this look like, who then gets involved. And so if this is not well defined, then engagement will happen as people decide it happens, so it needs to be checked. Civil society also lack policies that are inclusive. Within ourselves, we also don't have policies that are well inclusive, particularly for engaging people with disability or internally displaced, etc. So that was our group. Thanks.
Great, thank you very much, Florence. And then if we can move to room 4 with Mike, and then room 5 with Quentin, please.
Hi, I'll be speaking on behalf of Mike's group. It's Leslie here from AidsFonds. So I'll only add, in the interest of time, to a lot of what has been said we agreed with. But in terms of key opportunities, just to flag, yeah, for us, a big opportunity is this kind of literacy about the process, stakeholder mapping, just getting similar to what was done with the high-level meeting, like a civil society guide or something that makes it very clear on how we want to engage. And then we felt the upcoming G20 is a really important space, especially with the G7 now going to, being more caught up in other matters. And, basically we want to make a very clear message that their principles of engagement that don't include civil society need to be improved, and that we want to be part of that. And also in terms of the Global Fund, we see the upcoming replenishment as a really big opportunity in terms of promoting the Global Fund as a model of how funds can be used for pandemic preparedness, how community leadership is used within the Global Fund and should be in pandemic preparedness. But then lastly, also just highlighting the model of the country coordinating mechanisms of the Global Fund, as Florence was saying, getting that national leadership in country around matters of pandemic preparedness. We thought that the CCM model was a good model for that. And then in terms of effective ways, just the importance of coordination. We know that there's other groups working on these matters, but also groups outside of our sector that we don't may not normally work with. And how do we ensure that our efforts are collective and that we're working in smart ways? And I'm just trying to see. Yeah, I think that's the only thing I'll add there. And then, of course, in terms of barriers, we talked about, the barriers that just like in the HIV movement, key populations and marginalized people can have in engaging in these processes. And so, making sure that we leave no one behind. And of course, resources, very, very important. And I think lastly, for me, what has been a real eye-opener in now engaging more in the PPR world is just how closed the civic space is. And I think that understanding of why civil society and communities needs to be in decision-making, it's very, very new in a lot of these spaces. And so that's a huge barrier for us going forward. I'll stop there.
Great. And who from the last group with Quentin would like to present?
Hi, yes, it'll be me from the small but mighty group 6. In the interest of time, because I'm on the hour, I have to be short because we heard some things are repeated from the other group. A few things that I think have not been mentioned is the importance of trust, the importance for civil society and community organization to trust the process they are involved in, and the importance of trust among organizations, which was highlighted repeatedly. sorry, by the participants. In terms of next step of engagement, we talked about the importance of reaching out to governments and MPs, and to work to strategize and work together as civil society and community at the national level to define what kind of PPR do we want to see, and communicate these views to relevant national authorities. Also in the interest of them bringing these views into international meetings. We had some discussions about the importance of strengthening community health strategies and community volunteer networks, noting that they are a key part of surveillance efforts, need to be empowered, need to be recognized, need to receive stipends. And then we had a series of exchanges around the importance of capacity building for especially smaller civil society organization, and the fact that when it came to PPR, it has been at least a very expert-driven field so far, and there was some amount of confidence building that was important for civil society and community to be able to meaningfully engage and have the confidence of reaching out. I will stop here.
Thank you so much, Quentin, and a big thank you to all of the reporters and to the groups. If we don't get cut off by Zoom, I'm going to just quickly give some really short closing remarks. So first of all, again, a sincere thanks to all the groups for the feedback. It's clear that there have been some really rich discussions and we haven't really had the time to do them justice, but as I said at the opening, we will be reviewing the notes to make sure that we capture the more in-depth points that were made. I would like to say a special thanks to Patricia Jekanaya for the really great facilitation, as always, Patricia, and also a big thanks to each of the breakout room facilitators. I want to say a big thank you as well to the people behind the scenes, all the staff from my team at Frontline AIDS, from STOPAIDS, AidsFonds, AVAC, GFAN, and GNP+. Your efforts are much appreciated and they are key to the smooth running of this webinar, so thank you very, very much. It's been, I feel, such an engaging discussion, so of course I also want to say a sincere thank you to each of the speakers. You know, you gave us both the big picture of how this area is developing and of what is at stake, and what some of the opportunities are, but you also gave us really strong and practical ideas for action that we need. And I think that that's really what we needed from this discussion. Loud and clear, we've heard the fact that ensuring that communities not just have a seat at the table, but own several of the seats at any table in national level discussions is clearly critical, so that they're able to bring the many lessons that they have learned over 40 years of the HIV response and from other pandemic responses. And, you know, Cindy, you spoke so compellingly to what those different lessons are. In the report back, Florence has also spoken about the importance of really supporting that national engagement to take root and grow. And I feel like in my group, there was a strong emphasis on the fact that national advocacy needs proper resourcing, and we need to make sure that that's where the bulk of the advocacy resources are going. And I just want to say again that that point has been heard. As Eloise and Mike and others highlighted, there are a number of upcoming opportunities for global advocacy. I just want to note in particular the INB hearings, the pandemic treaty process, the G20. I liked what Leslie said in the report back about global fund replenishment, and critically, the push for community engagement in shaping the financing intermediary fund. Florence, you brought a really inspirational vision of what that engagement could look like, and Mike talked about the development of the governance principles, and I just want to remind everybody that there is an active role for all of you in helping to create those. As Florence, I think, said in the report back, there's also a need for us to work together more to develop a common position that we can be bringing into these processes and sharing with decision makers at different levels. And I think that's possibly one of the action points for my team at Frontline AIDS and for the other partners today. I just wanted to say as we wrap up that I think one of the things that is driving the PPR agenda, and all of our speakers have alluded to this in different ways today, is the recognition that we weren't set up either at the national level or at the global level to be able to cope when a global health threat like COVID came along. But I think in our community, we also saw, with what happened with the COVID vaccine and what is happening with other COVID health technologies, is very familiar for any of us who were working in the HIV response at the height of the AIDS crisis, when it took so long to get ART to people who needed it. We saw what the limits of global health solidarity were, and we saw or took stock of the fact that we have at the minute a global health architecture that isn't truly global. Global is not something that sits in one place and cascades down. Global is something that includes everyone. That is the nature of global. And yet we saw that our allegedly global health architecture is not set up to deliver on the right to health for all. And what's exciting about the PPR agenda is that we have an opportunity to start again, but we are also seeing some early signs that those same inequalities that we've seen could actually become more deeply entrenched, with civil society and communities excluded from key processes and decisions, and with participation from people in the global south particularly limited. So I think it's really clear that we can't have a new global architecture that is developed solely in Geneva, or that is led from Washington and that is cascaded down to the rest of the world. We need, as a community, to be working together to define the type of PPR we want, and to ensure that the voices of people who have been hardest hit by the existing pandemics, whether that's HIV, TB, COVID, Ebola, or others, to make sure that their voices are heard loudest and clearest. So, you know, as in my capacity at Frontline AIDS, I just want to say that we are looking forward to taking on that challenge and to collaborating with all of you towards this vision. And I look forward to more opportunities to work together. So thank you again to everyone that's been involved today. I wish you a good evening or good afternoon or good morning, depending on where you are. And we look forward to being in touch soon. Thanks again.